This scenario shows an opportunity to raise the issue of testing with a newly registered patient from Africa. This conversation could be undertaken by either a nurse or a doctor. The UK HIV testing guidelines suggest that any clinician should be able to discuss HIV testing with those at risk and obtain informed consent. Sometimes a guide or aide-memoire can help someone who does not have a lot of experience in HIV testing.
Hello, Mr. Ottergetsby. I'm Beth, one of the nurses here. I see that you've recently joined our practice. I need to ask you some questions about your health.
Yeah, that is fine.
From the form that you've completed, I can see that you have a history of high blood pressure.
Yeah, that is right. I take medication.
Do you have any other medical problems we should know about?
No.
Are you allergic to any medications that you know of?
No.
And are you a smoker?
I used to smoke, but not anymore.
And do you take any alcohol?
No, I don't drink.
I see you're from Botswana.
That is right,
I know that Botswana is a country with a high level of HIV infection, and I wondered if you had been tested for HIV previously.
No, I've never tested, no.
We recommend to people from countries with a high incidence of HIV that they should be tested, even if they feel they've not had any at-risk behaviours.
Okay.
It's good to know your status, and even if it is positive, there are now medications that you can take which control HIV infection. That would enable you to live a normal life, and you can only do that if you know your status. How do you feel about that?
Yeah, I've been wanting to know my status for a long time. So where would I test?
I can do the test for you here. It's a simple blood test, and we would make you an appointment to come back a week later for the result.
Okay.
I can make the appointment for the blood test with myself, and I can give you this leaflet in the meantime. Would you like me to make that appointment for you?
Please, yes, please.
Okay. Do you have any other questions?
In order to diagnose HIV infection, GPs need to be proactive in raising the issue of HIV testing in those who may be at risk. Even if a patient has previously had an HIV test, it is still recommended that they have a repeat test, especially if they have not had one in the UK.